Hi everyone, I'm Scott Bruce, President and CEO here at St. Mary's in Amsterdam.
And I'm Dr. Mahvash Majeed, Pediatrician at St. Mary's Amsterdam Family Health Center. We wanted to address our patients and staff at St. Mary's today and provide an update as there have been many changes and challenges throughout COVID-19, and we continue to see those effects. Scott, can you mention a few changes our patients might have noticed or need to know about?
Yes, as Dr. Majeed mentioned, we're going through a number of changes here at St. Mary's to be responsive to what's happening in our environment. We want to make sure things are as safe, as efficient, and effective as possible for our patients. A few of the things that we've done, changes that you're probably seeing. We had to temporarily close one of our sites that's over in Charlton. We're actually in the process of converting it from urgent care to urgent care and primary care, but that site will be open soon. It's given us an opportunity to bring staff back to some of our busy areas. Staffing, this is what this is all about. We're having trouble like pretty much every employer in the region, certainly every healthcare organization in the region, making sure we have enough staff to take care of our patients. As tough a situation right now as I've ever seen. But we're going to work through this and make sure we're as safe and effective as possible. Also, throughout the pandemic at different times, we've had to pause elective surgical procedures. Currently, we are back up and running. We're making sure that we're doing this in as safe a manner as possible, but we're back and running right now. But at different times, again, we've had to be mindful of what's happening and be able to reallocate staff where needed. We've also just reopened our COVID testing site, and this you have to have a prescription for, a script for the test, but this is going to be helpful in decompressing some of our areas where if there's patients that just need to be tested, they can go to the site instead of the other locations where patients are in need of more direct services. Now this is a fluid situation, so please keep an eye on our website for any changes and updates to what we're doing here at St. Mary's and general information about the pandemic. Dr. Majeed, will you inform us of what's happening from your perspective here regarding COVID-19?
Sure, Scott. Yes, here at St. Mary's, we have seen an increase in positivity and severity since late this summer. After last winter's peak in Fulton and Montgomery counties, we saw some hope in a decline of the number of illnesses because of the vaccine becoming available to our community. But however, with the Delta variant, which is a much more easily transmissible variant, and some waning immunity, the number of cases increased, and we're now in what seems to be a pretty significant second wave with many more people getting sick. The vaccine rates are also lagging behind, so we're not really at the percentages we should be to be able to protect our community as well. Because history has shown that with vaccines, that's what we use to protect ourselves and to be able to get rid of viruses that caused pandemics and epidemics in the past, like polio. We don't see polio in this country anymore, whereas they used to cause epidemics throughout the early 20th century. Smallpox was the original pandemic and epidemics that they used to see in the original vaccine that was created. And in addition to that, there's the Spanish flu that we just saw about 100 years ago, which when the flu vaccine came about, we were able to rid ourselves of the Spanish flu in a pandemic sort of form. And that's because of a concept known as herd immunity, which experts say when about 80% of the population is vaccinated effectively, the viruses lose their strength, so they lose enough bodies to be able to infect, and they kind of see their way out, especially in a pandemic sort of form. So even if they stick around here and there, it won't be, the severity that we see now.
We know a recent decision by the FDA makes the vaccine now available to children 5 through 11. Now we know when the version for adults came out, there was some hesitancy and still is. Dr. Majeed, what can we do to help address the hesitancy?
Okay, so as Scott mentioned, the Pfizer vaccine has been shown to have a robust immune response in children age 5 to 11, just as much as the original vaccine had. I think the concern many parents have is that they think the vaccine came about very quickly and they're worried about certain side effects like things like heart problems, things that they've heard about. And understandably, parents will be nervous to put something foreign in their children's body, and with everything they hear about on the news and all of these stories, they're very, very nervous. But rest assured, all of the appropriate studies were done for the Pfizer vaccine. They went through all of the different phases, all of the different trials. The reason why things happened so quickly is because of the urgency. We're in a pandemic situation. So all of the details of approvals were happening more quickly. The financial aspect, everything happened. The focus was on the vaccine, especially with children going back to school. We wanted to have a vaccine available for children who are going to be around each other in person again. The science part, as many children that need to be studied were studied. There was over 2,000 children who were enrolled in the studies around the world, and there was no myocarditis, there was no death due to the vaccine, there was no adverse events, but there was 91% effectivity shown with a 2-dose series, just like the original Pfizer, just with a smaller dose per time. The things that I mentioned with the falling very ill, that definitely happens with the actual virus, and kids are more susceptible now. And with the rising percentage of children falling ill with COVID-19, I would urge as many children as possible to be protected with this vaccine. The consequences we've seen with children's mental health, their education, and their overall childhood experience has been really difficult to deal with in the population, for parents, and the whole community. So with the recent vaccine approval, I'd say we're one step closer to getting back to looking forward to some normalcy together again as a community. And in the coming weeks, more places will have the vaccine available, so with any questions, you can always contact your medical provider. At St. Mary's Healthcare, we have and always will continue to be part of your family. I take care of children from the time they're born. I hold them in my hands, making sure that they're well and kept safe. So you can take it from us from here on out. We will always have your family and your children and the community as #1 priority in their health and their safety.
We hope this information is helpful in keeping our community safe and informed with the changes and challenges that are happening with COVID-19. None of this, by the way, our response at St. Mary's would be possible without the amazing support of our associates here at St. Mary's. Our focus and drive is to keep our community safe, moving forward as healthy and safe as possible, as we have for the last 100 years. Thank you.